Hello, and welcome to Massage Report 101. My name is Cassandra Quinlan.
And my name is Emily Piercy.
And today we're here to talk to you about acupuncture.
Now, Cassandra, what exactly is acupuncture?
Acupuncture is a non-medication therapy that involves inserting needles into the skin or tissues, treating physical, emotional, and mental conditions. It also affects parts of the brain, stimulating neurotransmitters that impact a client's immune system and decreases a client's perception of pain, making acupuncture a therapy that provides instant relief to clients. I wonder how someone can get into acupuncture. Emily, what are your thoughts?
Well, Cassandra, that depends on what your background is. If you come from a medical background and are a member of a regulated healthcare profession, such as massage therapy, acupuncture is within your scope of practice with some training. A program at McMaster University provides already licensed healthcare providers with 300 hours of continuing medical education. This meets the requirements that the CMTO sets for massage therapists practicing acupuncture. The CMTO states that a massage therapist must have completed an approved acupuncture education program, they must practice acupuncture within the scope of practice of massage therapy, and they also must practice according to the acupuncture standards established by the CMTO. This is very important information, as some programs provide knowledge that exceeds the scope of practice in which a massage therapist can work within. If a therapist wishes to practice acupuncture to its full scope, they must become registrants with the College of Traditional Chinese Medicine Practitioners and Acupuncturists of Ontario. After completing this continuing education course and final registration exam, graduates have the opportunity to become a member of the Canadian Academy of Medical Acupuncture.
Awesome. What if you're not a licensed healthcare professional? Can you still practice acupuncture?
Great question, Cassandra. The answer is yes. Georgian College now offers a 3-year acupuncture diploma program for people who are not licensed healthcare professionals, or if licensed healthcare professionals choose to further their education. This program provides all of the knowledge and skills necessary to meet the standards that the Chinese Medicine Practitioners and Acupuncturists of Ontario sets. Now, what do you think would make someone want to have acupuncture treatment?
Another great question. Well, Emily, like I said before, this is an alternative method other than prescription drugs because of its analgesic properties. Acupuncture is awesome for chronic pain due to a stimulating effect on the parasympathetic nervous system. Other reasons a practitioner would choose to use this technique on a client includes headaches, allergies, asthma, plantar fasciitis, and most commonly tendonitis to reduce hypertonicity in the affected tendons.
That's amazing. Now, what would a therapist find in their assessment that would make them want to use acupuncture?
If a patient comes in with a chief complaint in their elbow, you would perform a range of motion assessment. Common findings of lateral epicondylitis would include pain with active and resisted wrist extension, and with pain with passive wrist flexion. From these findings, some special orthopedic tests that can be performed are Mills, Cosen's, and Maudslay's. So now I'm going to be performing Maudslay's, and it's for testing lateral epicondylitis. So I'm going to put my finger on the lateral epicondyle, and I'm just going to apply resistance on her third finger, and she's going to go against it, and she's going to let me know if there's any recreation of symptoms or pain. All good?
Okay, now I'll be performing Cosen's test to test for lateral epicondylitis. So I'm going to palpate the lateral epicondyle, and I'm going to put my client in slight wrist extension and pronation, and I'm going to get you to resist against my pressure for 5, 4, 3, 2, 1. Is there any pain or discomfort with that?
No.
Now I'm going to be performing Mills' test to test for lateral epicondylitis. So I'm going to palpate the lateral epicondyle while passively pronating and flexing the wrist and extending the elbow. And is there any pain or discomfort with that?
No.
All right.
If tests were positive, this would indicate the use of acupuncture on the tendons involved in lateral epicondylitis. Another clinical finding would be if a patient complains on their plantar surface of their feet. This would indicate a clinical hypothesis of plantar fasciitis. For an assessment for this condition, active range of motion would not be affected. If there is any pain, it might be at the end range of dorsiflexion. Passive range of motion could elicit pain during dorsiflexion, and resisted range of motion would most likely be within normal limits. Some special tests to further confirm plantar fasciitis would be the flexor digitorum plantar fasciitis differentiation test.
Awesome. And what would the benefits be for these treatments?
Well, for starters, acupuncture can have a sedative effect on the body. This would be beneficial for people who have ADHD, anxiety, or sleep disorders such as insomnia. It also helps the body defend against bacteria and diseases, but the most common effect is to relieve or reduce the client's pain. This would be great for conditions like chronic back pain, fibromyalgia, migraines, and osteoarthritis. Now, Emily, I was thinking, what are some possible risks or contraindications for acupuncture?
While acupuncture is generally a very safe treatment, there are a few reasons why practitioners would choose to avoid acupuncture treatment on some clients. Some of these reasons include someone who has cancer, diabetic patients, patients with epilepsy, or on areas with poor skin conditions. Acupuncture can also be dangerous to pregnant women if it's applied in between the lumbar spine and the sacrum. If a patient has a pacemaker, a mechanical heart valve, or is immunocompromised, acupuncture should also be avoided. Another huge contraindication would be if someone is taking blood thinners such as warfarin. This would be unsafe because these types of drugs increase the risk of the patient bleeding.
Well, I hope you enjoyed today's segment on Massage Report 101.
Before we let you go, we'd like to know, would you take an acupuncture course to further your education? If so, why? And would you work within the scope of massage therapy? Or would you further your education and register with the Chinese Medicine Practitioners and Acupuncturists of Ontario? If you wouldn't pursue acupuncture, why not? Let us know in the comments.
Well, that's all the time we have for today. I'm Cassandra Quinlan.
And I'm Emily Piercy.
Hi everybody, welcome back to this episode. Today we are going to speak about a scary therapy, acupuncture, but we don't need to be scared about it. Acupuncture is part of traditional Chinese medicine, which is about 5,000 years old. It is based upon the theory of meridian or energy channels. The energy is called as qi, which flows through these channels for a perfect health when it is perfectly balanced. Acupuncture helps to restore the balance when it is disrupted. In a practical acupuncture session, we select the points based on the history of the complaint the patient presents with and the channels which are got affected. And after selecting the points, we clean those points with a alcoholic swab to disinfect that particular point, and then the needle is inserted in a skillful technique not to cause any pain. When the needle is inserted, what happens is that it restores the imbalances in the energy channel, and at the same time, if you look in a modern perspective and the conventional science, it releases a lot of endorphins, which are neurotransmitters which help for sedation and also for pain killing effects. I want to reassure all the clients or all the people who are watching this episode that acupuncture is not painful. It all depends on the skill of the doctor and the kind of needles which is used. So leave all the anxieties and approach the right qualified professional for acupuncture. Acupuncture has been well known for its management of pain, stress management, some neurological disorders like Bell's palsy or facial palsy, trigeminal neuralgia, some stroke conditions, and even in infertility of male or female, and also from depression, anxiety, and allergies. Several studies have been done to prove its efficacy in these conditions. But some important points to be noted in acupuncture is it cannot be given maybe during pregnancy, those who have malignant cancers, or those who have acute infections. During those times, we cannot really use acupuncture. And acupuncture can be utilized for any age group, right from maybe a toddler or an infant to old age up to 90 years. So that is it for today's episode. I'll be speaking about acupuncture safety in the next episode. Please subscribe to MDill, and I'll see you later.